So today we figured we'd do something a little bit different and kind of give you an idea on how we could possibly help you over the internet, not being in the same office as you. Chiropractors are traditionally thought of as hands-on practitioners. The adjustment, soft tissue, those are what are typically associated with us. And while those are powerful tools, they are by far not the end-all be-all. The end-all be-all is teaching people to move better and educating them on what to do when they are in pain. So the main way that we do this, at least the initial assessment, is the Mckenzie Method, or mechanical diagnosis and therapy, which is a physical therapy method that was developed over about 30 years ago. And I'll kind of explain that on the coming videos. So essentially the assessment is, the primary goal on day one is first to determine if your pain is mechanical. In other words, there's other types of pain, inflammatory or centrally driven, which don't really respond to movements. But mechanical pain is something that responds to a position or a posture or a movement that you're doing repetitively. In other words, we're able to change it quickly just by changing how you move. And so the first thing that we're going to do is look for something called a directional preference, meaning a direction that positively influences your symptoms and your range of motion. Those are the two main things that we can really objectively measure. In essence, pain is subjective, but only you know how you feel. So that's why we have to pay attention to how that pain behaves after a movement. If it's moving closer to the spine, away from the spine, if it's spreading out, getting more focal. These are all things that are kind of indicators as to how you respond to movement. Then us as practitioners are paying attention to range of motion changes. A lot of times we can get pretty rapid changes in range of motion just by doing a repetitive movement. So an example of a directional preference, let's say I have shoulder pain right here, and we think it might be coming from my neck. If I do this repetitively 15, 20 times, and that shoulder pain gets better, that's likely my directional preference. So if there's a directional preference, there's also usually a direction that's bad for me. So in that essence, maybe going this way could be not the best. It could actually make things worse. That's why just randomly stretching your neck or your low back repetitively oftentimes is disadvantageous, because you're doing a little bit of something maybe that you really need, and then you're doing a bunch of stuff that actually is hurting you. On day one is to figure out, A, is your movement a driver of your pain? And B, is there a movement that we can find that positively influences it? Once we can kind of get that first aid component in to kind of get stuff to settle down, improve range of motion, then we can sprinkle in some functional rehab, some education on pain science, some breathing mechanics that really give you a long-term success rate of not having to come back and repetitively see people like myself and just getting quick responses, quick pain relief, but nothing lasting. So that's kind of an example on how we can, just over a phone, over a Skype message, can actually really improve people's symptoms and teach them on what they need to do to stay out of pain so they don't have to see people like us. So any other further questions, any comments, feel free to comment below or shoot us a DM. Otherwise, I hope you have a great day.